thyroid disorders can either be a disturbance in the level of your thyroid hormones. That is, your thyroid hormone or your thyroid gland rather is supposed to produce two hormones, which is T4 and T3. So if it is producing too little of this hormone, there is a condition known as hypothyroidism. And with hypothyroidism, the defect may be in your thyroid gland itself or in your pituitary gland, which is supposed to send these signals to the thyroid gland for production of these thyroid hormones. This is about hypothyroidism. Then hyperthyroidism or thyrotoxicosis is when there is too much of circulating thyroid hormone in your blood. So this can either be because there is too much thyroid hormone being produced in your thyroid gland, or it can be that in certain conditions which are known as thyroiditis, there is a preformed storage of the thyroid hormone in the thyroid gland, and any sort of disturbance to this or any sort of destruction of the thyroid gland can lead to these hormones spilling over into the blood, leading to excessive thyroid hormone in the body. And here again, it becomes very essential to differentiate between these two conditions. So this is about the defects in your thyroid hormone levels. Then there can be other problems with the thyroid gland as well, like an increase in the gland size, which is known as a goiter, and there can be certain nodules which can arise in the thyroid gland, where the question is that one, is it malignant? Is it producing any sort of excessive hormones? And should it be operated or not? Hyperthyroidism, or rather thyrotoxicosis, is a condition where there is too much of thyroid hormone in your blood circulation. So it can be because your thyroid gland itself is producing too much of the hormone, which is known as hyperthyroidism, most often due to a condition known as Graves' disease. It can also be because of some sort of clinical subclinical infection, which has led to a destruction of the thyroid gland to some extent, where the preformed and the stored hormone in your thyroid gland spills over into the blood circulation. This is known as thyroiditis. It can sometimes be because the thyroid hormone is being produced elsewhere in the body. It can be because there is some nodule in the thyroid gland which itself is producing excessive thyroid hormone, which is autonomous and not under the control of feedback regulation. Then there can be a entity known as a toxic multinodular goiter, where there are multiple nodules in the thyroid gland which are producing excessive hormone. It can also be drug induced, where either a surreptitious or an intentional use of thyroxine, when it is not prescribed or beyond dosage that has been prescribed, can lead to thyrotoxicosis. Along with this, there are some very rare disorders like a TSH producing pituitary tumor, etc., which can also produce thyrotoxicosis. The symptoms of hyperthyroidism usually include an increase in the heart rate. That is, usually people will experience excessive and forceful heartbeat, which is known as palpitations. They will have tremors of their hands. They will experience a weight loss. Along with that, some may report a swelling in the thyroid gland, prominence of the eyes, change in the nails, change in the skin, and some sort of gastrointestinal disturbances like diarrhea, like liver dysfunction. These may also accompany thyrotoxicosis. In severe cases, there can be cardiac failure, that is heart failure, and a change in the mentation or change in the behavior of the patient might also be seen. And usually an unintentional weight loss will accompany these features. In order to treat thyrotoxicosis, which is an increased level of the thyroid hormones in the blood, first we should know why there is an increase in the thyroid hormones in the blood. So for that, a few tests are to be done in terms of blood tests, in terms of thyroid uptake scan, which will tell you whether the thyroid gland is over functioning or it is some other reason. So if your thyroid gland is over functioning, there are some medications, there is a radioiodine based therapy, and there are some surgical options which can help uh, in the control of these thyroid hormone levels. If it is because of thyroiditis, it usually lasts for 2 to 3 months, the toxic phase of thyroiditis, where only a control of the heart rate and maybe some steroid medication if there is excessive pain over the neck, that it may be required. If it is because of certain other reasons, which are quite rare, then an individualized approach based on why the thyroid hormone levels are raised may be required. But most often, it is because of these two conditions. One is that your thyroid gland itself is producing too much of the hormone, usually known as Graves' disease, and two, that there is some sort of clinical, subclinical infection or some other reason which has led to some destruction of the thyroid gland, leading to a spilling over of the thyroid hormones into your blood circulation. If hyperthyroidism is because of Graves' disease or if there is an overproduction of the thyroid hormone in the body, it is usually autoimmune in nature. That is, there are some antibodies formed in the body which are stimulating the thyroid gland to produce more and more thyroid hormone. Here, the tendency towards autoimmunity is somewhat genetically determined, and along with that, there are some environmental triggers as well. If it is a multinodular goiter which is producing this, probably iodine deficiency, especially in the sub-Himalayan region, contributes to this sort of goiter. So, a good intake of iodine or iodized salt may help in this to some extent. But other than this, if we look at thyroiditis, even like if let's say 100 people get some sort of small infection here and there, it's very difficult to predict who is going to develop thyroiditis. So per se, for most of these disorders, other than maybe a good iodine intake, there is no real evidence scientifically to prevent any of these conditions.